Well, we're so lucky to have Randy here today. We had the Church Health Center speak to us a couple years ago, and we were blown away. Anybody who knew the Church Health Center 10 years ago, 15 years ago, it's just night and day. So we're very enthused about hearing what Randy Kostiuk has to say. He has a very modest bio. He is working towards improving the health behaviors in the community of Memphis for over 20 years. He's a 1996 graduate with a MS in health promotion from the University of Memphis, a teaching assistant, then adjunct instructor until 2010. Wow. 13 years with Meriton, working with Memphis's aging population. And then the past 7 years, he has worked with the Church Health, developing new health coach programming, and now in community engagement. Thank you so much, Randy, for coming today.
Thank you all for having me. I really appreciate it. So I think it was Ken Hall may have been with y'all a year, maybe a year and a half ago. We are officially on year 2 of our new home at Crosstown. So it's still new to us. I would trade the first year, it was very hectic, moving into a big building and all that kind of stuff. But the 6 months to a year before that move was the most anxious time for our staff as a whole, that I wouldn't want to go back to that time. So in side conversations with most of you, it seems like everybody knows at least a little bit about Church Health, who we are, what we do. We actually are no longer referred to as Church Health Center, which is kind of funny because we've always been called Church Health, even when we had the center. Now that we officially dropped the center, more people call us Church Health Center, so that's the way it works. And the thought process behind that is when we were moving over to this big building at Crosstown Concourse, which has gotten a lot of wonderful attention, not only within the city, but internationally, we didn't want to be known as just a building, because the focus was so much on the building. We wanted to be known as a place that people come to, and we actually reach out to the world to get the message across. So today what we're going to do is we're going to talk a little bit about Church Health and the services real quick. Then we're going to work and discuss this beautiful tool called the Model for Healthy Living, which first and foremost is a tool for your own wellness, and then we'll answer questions, because there's probably a ton of questions about who we are, what we do, and how you all can help us and we can help you. So primarily, Church Health cares for the working uninsured population in Memphis and Shelby counties through serving their wellness needs, not just the medical needs, although the business revolves around the medical treatment for people. We have a holistic approach, and that's going to kind of come back to that model for healthy living. We are a nonprofit, and first and foremost, we are a faith-based organization. All of our entire services are housed in our building at Crosstown Concourse. The reason we moved 2 years ago, and Ken may have went over this, but we were spread out into 13 different buildings around Peabody and Bellevue. We've been in business for 32 years as of last September. So that's a long time. I'm proud to associate with the trusted name in the community of Church Health. And we love coming out here doing these things and kind of telling people who we are and what we do. Primarily, we serve the working uninsured population's medical needs through our clinic, which we have 60 exam rooms. We have wonderful physical rehabilitation space. We have 24 dental chairs. We have a full behavioral health department, and we have now partnered with the YMCA for our fitness facility needs. We have gotten out of the business of running a fitness facility, and now we partner with the YMCA, and that's been a huge win. We cannot survive without all of the wonderful partnerships in the community with all of the organizations. Every major hospital, we have an army of volunteers, both medical and non-medical, that help us serve the community of Memphis and Shelby County. There's a couple different programs. Typically, we have what we call an established patient base. We want everybody to become an established patient eventually. And that means that we become the patient's medical home. That is for the working uninsured population. So to qualify to become an established patient, there's a working criteria which has flexibility built into it, of course, and then there's an income criteria. But we also have a huge growing clinic called our walk-in clinic, and that's if anybody in the community, even insured people, if they wake up and they're sick that day and they can't get an appointment someplace, they can come to our walk-in clinic. And that is a huge, huge growing need in the community of Memphis. And we have people coming from all the way out here to get to that walk-in clinic. Now, when those people come through, if they qualify to become an established patient, then we urge them to try to go through that process. The other real important thing that ties directly to this population more than anything is what we call our Memphis Plan. And Memphis Plan is how we partner with small businesses in the community to help their employees and small businesses get health care. So out here, I live in Arlington, so Faith Family Medicine agrees to see between 5 and 10 patients on their docket, and we partner with small businesses. So let's say I'm a landscaper. I got 4 employees that work with me on a regular basis, but probably somewhat seasonal. There's no way I'm going to be able to get them on Blue Cross, Blue Shield, or Cigna. So we partner with, you can partner with Church Health for like $70 a month, which we hope is split cost between the employer and the employee. And then we assign that person to one of our volunteer clinics. And they have $5 copays, and they can get up to $55,000 of services throughout the year. We have partnerships with all the hospitals. We have partnerships with everybody in the community to help the community improve the health and wellness. Now, the organizations that help us, specifically in the hospital area, do it for really 2 important reasons. Number one, they know that a healthier community is better for all of us because there's direct correlation between a vibrant, healthy community. But there's also economic reasons why Methodist partners with us, why Baptist partners with us. And that is simply, we help keep people out of the emergency room, which is exorbitant, hundreds of millions of dollars that costs the hospitals in the city of Memphis. So if we have patients working with us trying to manage their diabetes, trying to manage their hypertension, come to us for regular appointments, it keeps people out of the emergency room. That being said, we have services that wrap around all different avenues of wellness. So let's talk about our model for healthy living. I love this tool. I've been in the health and wellness business since I've been trying to keep up with my brothers getting in shape when they were older than me, and I went to the movement aspects and trying to keep in shape and all that. Through my favorite of all of these components, through exercise, I came to experience all the different components and understand the benefits. So the model for healthy living is first and foremost a tool for understanding what wellness is. It's more than not being sick. It's more than just going to the doctor. It's more than exercising and eating well. Everybody, when we talk about being healthy, goes to, oh yeah, I need to exercise more and I need to eat better. It's a conversation that we have all the time. Those are really important. But there's other pieces to the puzzle that are as important, okay? So when we talk about this through the presentation, understand that none of what we're talking about is about being perfect in our lives. It's about trying to get balance, and everything we talk about, of course, is easier said than done when we're trying to make changes in our own life. So this is really cool, and I don't want you being hard on yourself. We're going to talk about maybe, if we have some time, setting some goals. So the different components. Of course, church health, so we have to have faith life at the top, right? I deliver this presentation at churches all the time, and they can whip me up and down the aisles with all the information and the knowledge they have about Bible and historical studies. So I always question them about their faith life, and I say, but do you realize and utilize your faith life as a component of your wellness? Do you connect the dots of having a strong faith life and bring that into your wellness? Do you understand and connect the dots between doing the specific behaviors to improve your faith life and understanding how that balances out your life as a whole? Sometimes we just miss that connection, and not just faith life, but all but all the components. So, we are non-denominational by nature, so that's okay. So our definition is somewhat general, and please feel free to give me feedback on any of these if you have an opinion on it. Building a relationship with God, your neighbors, and yourself. That's pretty simple, right? I like to use the old saying, when the man or the woman is right, his world is right, and that's what comes in context right here. So understanding how you fit in, understanding that there's a power that's greater than us that impacts not only us, but how we react to our community and look at ourselves. All important pieces. Don't worry too much about it because we have everything in front of us. Medical, of course. I was talking about how important it is to have a medical home, so that's why we try to get people to become established patients. Think about it in relation to having, anybody got a really good car mechanic in here? You have trust, right? You can communicate with that mechanic versus going someplace else. And you always will feel that you can explain the issues with your car and they will listen to you more so than if you're going, or if you're out of town, or you don't have the ability to get to them. It's the same thing times about 100,000 in value of having a provider that you can communicate with. So we really encourage creating and gaining a partnership with your medical system. And this is a continuum. This is everything from, I'm not going to do anything about my blood pressure unless I know I'm at risk for blood pressure. So how would we know if we're at risk for blood pressure? We would get our blood pressure checked, right? The simplest thing of putting your arm in a cuff, even if you're waiting at the pharmacy for something, is a partnership at some level with the medical system. So that growth is important. On the other side, it's, I have diabetes and I'm working with my medical provider to manage my diabetes. Whether that's getting your A1Cs checked, whether that's managing your medications, getting your regular checkup. So there's a partnership through that continuum, which is very important. That's why we encourage our patients and our staff and everybody in the community to latch on. That's why primary care is so huge, and that is the real reasons why. There's also economic, but for us too it's economic, because that's why the insurance companies want to steer everybody to primary care first. So it's important to have that relationship. Movement. This is our secret word for exercise. It's such a key component to our overall wellness. And there's also such stigma attached to it. So this is a true story. I'm doing this presentation to we have a preschool called Perea, and we have teachers. And the principal and her assistant, I'm talking about movement. We're going over some tips about how to improve your movement and just start something. And they're causing such a stir and they're talking amongst each other. I was like, all right, time out everybody. Alicia is her name. I got permission to use this story. So I said, Alicia and Allison have something to say. So I stopped the presentation and I started talking to them. And they're like, oh, Randy, you and your movement, you're always talking about movement and how important it is. Me and Allison have been walking every day, and they're rolling their eyes about what the burden this movement is. She goes, you know, we've been getting out, we've been walking at lunchtime, and you know, it's kind of cool because we can get away from work, and then we've been getting on each other about our lunch. So Alicia and Allison proceed to give about 5 to 8 different benefits that they've gotten from movement over the past month that they've been doing the exercise. And I actually lost a little weight, and it's been great stress reduction, but they're still rolling their eyes about the exercise. So that's the perception that we have, that this movement is such a burden, but there's so many benefits. So she actually did my movement presentation for me to the rest of the class because she was given a list of benefits. I love it for 2 main reasons. There's no better component on here that gives you immediate feedback. You always feel better after your movement. And notice I'm not saying lifting, I'm not saying swimming, I'm not saying doing your marathon runs. Whatever movement option is available for you. And there's no better stress reduction process than movement. So keep that in mind. Work is very important. It takes up a lot of time in our life, but we like to view it as not just where you get your paycheck from, but all the different roles that we have in life that impact us. So I'm a little bit lost this spring because this is the first time, hopefully it helps my golf game, but this is the first time in, I think 6, maybe 8 years that I haven't been coaching baseball in the spring, because that's a huge role in my life for my kids. They've gotten old enough, not that they don't need me coaching, but they think that they don't need me coaching. So it's a big void in that. So we have all these roles, and I didn't want to get into baseball coaching in the first place. I was happy on the sidelines, but I got pulled into that, and I realized 2 options. You can either be miserable or you can learn and try to make an impact. So the moral of that story on work is not just the job that you have, but all the other relationships that you have within your job, and then all the other jobs that we have in life. We're children to parents, we're brothers, we're sisters, we're coaches. All these different things. And the thought process is just understand how you interact with all those different jobs and roles and try to bring your best. So simple formula, but emotions. This is, to me, this is the glue that keeps it all together. So I like that old saying too, that it's not necessarily what happens to you in life, but how you react to what happens. So there can be, the goal here is trying to maintain balance, right? The goal here is trying to evaluate where we are at any given time and where we feel that we could make an improvement. That's important. We're going to circle back to that in a second. So things happen to us on a regular basis all the time. We have patients that get diagnosed with diabetes, and a lot of times there's a fatalistic mentality of, oh, well, my mother's mother had diabetes, she lost her leg. My mother had diabetes, she was never the same. I knew I was going to get it. This is our patient speaking. And they don't know where to start. So that's an emotional aspect. And then, has anybody ever said when something not so great happened to us, why me? Anybody ever? Did you look up when you said that? All right, so now we start to connect the dots between how these things are connected. That's not a judgment on why me. That's not a judgment when you're looking up, but you're looking for answers and you're tying into some level of belief that's bigger than yourself. I wouldn't say why me is the most positive attitude, but it's a natural reaction, okay? So this glue that keeps everything together, these emotions, are going to take bumps all the time. What we want to do is understand where we're at any given time, understand what's causing that. So there's a medical issue that you got diagnosed with diabetes that hits your emotions, which therefore you look up and say, why me? And you're not feeling so good, so you have high levels of stress, which is going to always impact our family and friends, right? And has anybody ever had stress impact their work, even though it's not work stress, or work stress impact the family that has nothing to do with it? All these things are connected. Now, the trick is, easier said than done, is we want these connections, we want this synergy to work with each other when it's going good. Think of it as a one-way street. So I want to improve my emotions when I get done exercising, which is going to motivate me to eat a little bit better, which is going to motivate my long-term health, which ultimately, if I have a couple of these things going real good, my faith life is better. And or if something happens, I know I'm moving around, but this is how puzzling this is, but it's not complicated, it's simple but hard, right? I want to utilize these things in the positive way, but if something happens in here, in one of these sections that we necessarily can't control, we don't want that to bring our balance down in other areas. So we want to try to maintain a full circle, not have bumps in it. Again, easier said than done, right? So it's a simple act of, I finally got on a decent exercise routine, I'm eating good, and everything's really rolling along. Then I step off the curb and twist my ankle. I can't play golf anymore, so I can't see my buddies, so I'm stuck at the house, I'm a little bit more miserable, I can't get my exercise in, so everything kind of comes down. What can we do? Well, there's 1,000 different ways to try to bring that balance back, but we can't get there unless we start thinking clearly and try to adjust our emotions. So again, I'm going to say it again, this is all easier said than done, but now this little tool helps us connect the dots, even on the simplest things of, why am I grouchy at 11 o'clock in the morning? Well, I got in late, I didn't get breakfast, I had too many cups of coffee because I was hungry and I'm scurrying around at work. Just identifying a reason and being able to kind of peg that. All right, so the emotions are the key. Nutrition is probably the hardest piece of the puzzle to try to balance all the time. And again, we got to throw perfection out and try to work on trying to maintain balance. I think at every point in our lives, we've had some type of trouble or challenges, I should say. I tried to get rid of those qualitative terms like good, bad, trouble. But nutrition's hard because it's thrown at us from every aspect, and it's usually tied directly to our emotions too. So again, I just gave the example of, if you're hungry, you're a little bit anxious and irritable. What happens at lunchtime after you're angry, you're hungry and irritable? You probably can have a tendency to eat too much, and then what happens? The crash comes, right? So the bounce. So one of the things that the health promotion field has done a little bit wrong specifically to nutrition is they always tied it to long-term benefits of reduced risk for heart disease, reduced weight gain. And I think the trick is tying that to immediate benefits, immediate feedback. So has anybody, for whatever reason, only eaten about half of what you normally eat? Did you realize how good your energy was, how you didn't feel slow, how you didn't feel stuffed, how you actually went to the bathroom easier when you don't stuff yourself? That's even with not necessarily quote unquote healthy foods, but just portion control. So try to attach an immediate positive feedback to the food that you eat. Try to give yourself a pat on the back when you do a little bit better. Those are good ways to work on your nutrition. Portion control is first and foremost on there. Fruits and vegetables, and then just manage your fat, sugar, and salt intake. And then of course friends and family. And I don't even really have to talk too much about friends and family because we all know the challenges that come with that. Not only things that we can control, and there's no other area that's more tied, maybe faith, but friends and family with emotions. But the things that we can't control that impact us. So a loved one being sick, we can't necessarily control that, but it impacts us tremendously on our stress and emotional levels. So how do you manage that? There's no single answer for that, but the understanding just that maybe your faith can carry you through that and you don't have to take the burden of those emotions. Yes?
This is a great blueprint. How does the typical church health patient get all this information that you're giving us?
What a wonderful question. So we actually have health coaches that work as a part of the medical team. And within that team, they work with a patient setting goals in these specific areas. Now, for just about all of our patients, if medication is in need, that becomes the top of the food chain, right? Because before I'm going to work on you getting some exercise and eating more broccoli, I got to get you on your medication if that's the case. So what happens with the patients is they're so overwhelmed, and with our patients often, they have so many issues going on that they don't know where to start. So working with the health coach, I just identify an area that is a priority for the medical team, but it's also a priority for the individual, and then set goals in that. So we simplify. So we use the same formula for us. So give yourself an evaluation. We have this really, really complicated system. It's called How Satisfied Are You on a scale of 1 to 10. We wanted to keep it simple, and we want to make it about you, right? Because who's the most important person in our lives? We are. It's not that we can ignore the doctor's orders. It's not that we can't pay attention to all of our bosses at home and all of our bosses at work. And the pastors, all these people telling us what to do, and that's great. We have to evaluate, but ultimately, if we're going to make an improvement, it has to come from an area that we feel is important. So we get there through conversation with the patient. So there's certain things that the patient must do, and usually that revolves around medication. But other than that, we work with them to set goals to get them going in the right direction. Here's the really cool part, is that improvement in one area always bleeds into improvement in the others. Go ahead with the second question.
Well, I was just wondering, do they fill out a questionnaire if they come in
We
at
actually,
all?
yes, we do. We actually see the patients in the clinic, and then we do follow up with the health coach. And we do this evaluation. We've got data on over 1,500 patients. Guess what 2 areas were the most popular areas that they wanted to fix?
Weight.
Well, exercise and nutrition. Yep. Everybody that set a goal almost to a T out of these 1,500, everybody who set a goal in one area had more improvements in the other, mostly in the area of emotions.
Oh.
So when they exerted some type of goal and had success, that led directly into positive emotions. We actually tied it to our satisfaction with life, not ours, but it's an old satisfaction with life, and we saw parallels with overall satisfaction with life. So yes, we have conversation, we set goals, we document those goals on this really complicated, wink, wink, very simple system of 1 to 10. Where do you think you're at? We thought with our patients that it'd be a lot of faith and more in medical, but they went back to the same old thing. I gotta exercise and eat better. Second, did you have a question?
I was just thinking, because where I work at HPA full time, it's time to start my strength Wednesday nights and weekends. Our healthcare to do something like that, it costs us $1,500, the whole package, a month. So, how does church health partner with small businesses to reduce that $1,500 per employee?
Well, that's one of the Memphis Plan is the way that we can do that, and we can deliver affordable quality health care by having a plethora and an army of wonderful volunteer providers and the support of the community. So that our health coaches are full-time staff members, yes.
Talk about who fits the profile more specifically that would use your service in case we run into people in our everyday networking that do not have insurance but they work.
So focused on the medical services, typically so half of our, at any given time, between 40 and 60%, roughly half at any given time, of our patients over the past 2 years have been Spanish speaking. So that's a population that is, so established patients, it's anybody that's out there doing their thing, working, but don't have access to quality health insurance. And then through the walk-in clinic, anybody that wakes up that is sick, that doesn't have a primary care provider that you'd go to, then you would come to our walk-in clinic.
And the financial, what, is there a maximum that they can be earning to qualify?
Yeah, I don't remember those numbers off the top of my head, but so all the services also go on a sliding scale too. So we have 1 or 2 patients that, and this is success stories, that started off with us, were uninsured, and then they've had success in life and keep coming back, and they have insurance, and that's not a bad thing for us because we actually get paid full amount on that, so we like that, and they have a trusted family practitioner that they've been going to for years, so why change? Now that we have the ability to take insurance. We'd like to get up to eventually 15 to 20% of our patients being insured, which is really new for us. Yeah, but 2 reasons. More people have insurance that don't have any place to go, and we don't mind it because, again, that helps out with our bottom line on cost.
I was just gonna comment, years ago I saw my physician had a certificate of appreciation from you all, and so many of the doctors in Memphis donate a certain number of hours a month. Is that how that works?
Well, some come in on site, what we call, and come in once or twice, 3, 4 times a year, and then some see patients at their spot. So it was on site versus off site.
We need to praise those doctors.
Oh yes, absolutely. And when you see them and you see that certificate, high five them. Tell them thank you, because it may not be directly for you, but it's the partner in the community, and the person sitting right next to you could be our patient, and you don't even know. Yes.
A number of years ago, when people would go to the Church Health Center, it was a long wait, sometimes practically half the day or more. Has that improved?
Yes, and that was probably in our walk-in clinic because we didn't have the space to be able to, we would pull one doctor off and try to fit people in. Now, it's still first come, first serve, and there's still a little bit of wait in walk-in because it's such a growing need. But yes, that's one of the exact reasons when we moved into this nice, beautiful, we didn't just go to Crosstown because it's a cool spot. We went there because we had more access. So now we can have providers, we can have specialty, we can have our volunteers all in the same space. So yes, that's a huge need, and that would have been in our walk-in clinic, and that's a huge need for the community of Memphis, is those walk-in visits.
Wow, well done, what a
Thank you all very, very much. We appreciate you.